Let's talk about laser vision correction options, specifically Lasik. Watching patients' lives transformed by Lasik is one of the favorite parts of my job. I'm happy that you're considering having it done. Lasik is performed just down the hall in our operating room. It's a fast procedure taking no more than 20 minutes. Prior to surgery, patients can take a mild sedative to help them relax, and it's all done with eye drops that numb the eye so it's completely pain-free. Throughout the procedure, patients lie flat on their back on the surgery bed. For the first step in the process, our surgeon uses a laser to create what's called a flap. We use all laser technology here, so the surgery is done with a laser from start to finish. After the flap is created, the surgeon will lift the flap and use a separate laser to apply a corrective treatment. During this treatment, you will hear a buzzing noise and you may smell a faint burning smell. Both of these are normal. After the treatment, the surgeon will place the flap back down and you'll be done. Even immediately after surgery, patients will see improvement in vision. On the day of surgery, however, the vision will fluctuate quite a bit. The eyes will likely be red, they may sting a little bit. You will need someone to drive you home from the surgery. The next day, the vision should be about 80 to 90% recovered. Most patients then are safe to resume most normal activities like work or driving the next day. Eye drops are used for 1 week. These are 3 medicated eye drops and they help the eye to heal up in the most healthy and precise manner. You'll get written directions for these. There are some things you'll need to avoid after the surgery. For 3 days, it's very important not to rub the eyes. We'll provide you some eye protection to wear when you're sleeping. It's also very important not to get any water in the eyes. We'll provide you some goggles to wear when you're showering. For 1 week, you can't use any eye makeup. And for 2 weeks, you'll need to avoid swimming pools, hot tubs, and tanning beds. You'll get written directions for these instructions, and someone will go over it with you again the day of your procedure. Lasik is a very safe procedure with long-lasting vision correction results. However, like any surgery, there are some side effects. The number 1 side effect associated with Lasik is dry eye. The eyes do tend to be dry for 3 to 6 months after surgery. We recommend several things to help reduce dry eye after surgery. The use of over-the-counter teardrops are recommended frequently in the first several weeks and reducing use as you get further out from the surgery. Others are in-office procedures that we recommend prior to the surgery. We call this the ocular surface package. It's a 2-step process. Step 1 is using an instrument to gently clean the eyelids and eyelashes. This procedure removes any excess bacteria buildup that can grow along the eyelashes, which helps your eyes to produce naturally healthier tears over time. It's a fast and comfortable procedure taking about 15 minutes. The second step is a warming and massage of the glands in the eyelids with an automated device. These glands line the eyelids and are called the meibomian glands. By warming these glands, they produce higher quality oil. The oil then flows onto the surface of the eye, producing naturally or healthier tears. The effects of this treatment can last for several years after it's performed. After your Lasik procedure, the surgeon can also place a blocker in the duct that the tears drain out the eye through. This duct is a small hole called the punctum. By placing a plug here, this will help keep more of your own body's moisture on the surface of the eye. The plugs we use are temporary, they last for 3 months, and they slowly absorb over time. They help to promote the best comfort as well as vision clarity in the months after the procedure. The second side effect of Lasik is glare and halo around lights. People do tend to notice these for 1 to 3 months. After that, most of the time they do go away completely. There is a small chance of issues that could arise related to the flap. These are uncommon, occurring about 1 in 100 in our office. This could be things such as inflammation or swelling associated with the surgery, Some cells could grow from outside the flap where they belong to underneath the flap where they don't belong, or rarely there could be a wrinkle associated with the flap. If any of these were to occur, additional eye drops might be necessary, and in some rare circumstances we might need to perform a separate procedure in the office to make some adjustments. Finally, our hope with the surgery is you'll have one surgery, you'll see very clearly, and the results will last a long time. Most patients have this experience. However, there are some things that could interfere with that. The first of these occurs in the short term, and it's what we call underhealing. Underhealing means you don't quite heal as anticipated and your vision doesn't reach the clearest level. Should that occur and you've healed with some prescription, we may need to perform a second procedure called an enhancement to adjust for this. This can be done several months after the initial surgery. There's also something called regression. Regression is a long-term change or drift over time, meaning that patients will see well initially after surgery, but then months to years later this drift or shift occurs. Should this occur, another procedure called an enhancement can be done to adjust for vision. Finally, there are considerations for those over the age of 40. At the age of 40, there's a process called presbyopia that starts. Patients will then need some form of vision correction for reading up close. If LASIK is done to correct for distance, patients will need to wear reading glasses for looking at close activities. There is another option called monovision, in which one eye is corrected for far and one eye is corrected for close, which would reduce the need for reading glasses. It is important to note that surgery does not create this problem or issue. For patients over the age of 40, you would have to deal with this in another way if you don't have LASIK, such as using bifocal glasses or bifocal contact lenses. Ultimately, LASIK is a very safe and successful surgery that has a long-standing history behind it. I'm really excited that you're considering having LASIK with our office.